Hi everyone, my name is Sarah Druck. I am currently an RN at Lancaster General Hospital. I work on the oncology unit 8 Lyme, and I have since I graduated nursing school for about a year and a half ago. I am also the mom to 9-year-old twins, Jack and Bella, girl and a boy. This is them when they were little, and a more recent picture of them. So between work and school and shuttling them around to their different activities, I don't have too much extra free time. I am married. I've been married for 10 years to my husband, Jason. We live in the York area, Wrightsville, if anyone's familiar with that. He has lived here his whole life. I've lived in York since I graduated college in 2001. I have a bachelor's degree in therapeutic recreation from York College. With that degree, I ran an after school program for Phil Haven. It was for kids with psychiatric and behavior disorders. It was teaching them basically coping skills and how to interact through play, through just modeling appropriate skills. I did that for many years and got kind of burnt out. So kind of switched tracks and I became an rep for endoscopic equipment in the operating room. So I worked at in the operating room at LGH, Women's and Babies, and at the health campus. So any surgeries that had a scope, I was involved in. I was more off-field support. I never really had, never was like with the patient involved in the surgeries. And stopped doing that when my kids were born. They were preemies, so I stayed home for a couple years with them. And when they went back to school, I really decided that I wanted to kind of change gears and went back to school myself. So in 2016, I graduated from Pennsylvania College of Health Sciences with my ASN. And because I have the bachelor's in another field, I was able to do the MSN Bridge program. So I completed that. And this is my second master's course. And this is probably about my fifth online course. So everything is still new to me. I'm not the most tech savvy person. So still kind of, getting, just figuring everything out. But from what I understand from this course, we will be doing weekly discussion boards, responding, I'll be posting my own, responding to you guys. We'll have this video and another video that summarizes up our final paper, reading throughout the week, and kind of if there's any questions, there is a whole separate discussion board or to reach out to Joe with any questions. And then also, sorry, I'm going to read from a little bit of paper from my definition. I still print everything out because I'm not a big, again, not tech savvy and don't really like reading online. So I print things out when I have to read them. So to define innovation, I used the one of the definitions from the article Innovation in Healthcare Delivery Systems, a Conceptual Framework, because it specifically mentioned healthcare innovation. Defining it as the introduction of a new concept, idea, service, process, or product aimed at improving treatment, diagnosis, education, outreach, prevention, and research, and with long-term goals of improving quality, safety outcomes, efficiency, and costs, which I think is pretty much sums up, what we hope to do in the healthcare field. Two of the examples they use of healthcare innovation that really impacted me in my career so far or in previously was the Da Vinci surgical system. My job as the surgical rep for the endoscopic equipment, it was pretty neat because I got to see the difference between when they would have to do a completely open surgery versus the minimally invasive laparoscopic surgery where the people would leave, for like say for a gallbladder, they would have maybe 5 incisions, very, very small. But now with the Da Vinci surgery, you can have your gallbladder out with only one, 2-inch, 1-inch incision site, which is pretty amazing. And the quality of what the doctors see, what the surgeons see, was just amazing. It was so high def, seeing their field, their view. So that's been pretty amazing. And then also how they mentioned the CyberKnife. I have many patients who use the CyberKnife, the Gamma knife, for radiation, and it's been a game changer in my field. go following along the frameworks, I use the reference from the article, The 5 Imperatives Addressing the Healthcare's Innovation Challenge. And they basically said there was 5 of those imperatives. Making value the central objective was huge. It says basically improving outcomes and reducing cost. Healthcare costs are skyrocketing, and the outcomes don't always show that. So we need to be able to try to reduce costs and obviously improve outcomes. Promoting novel approaches to process improvement, I think, is huge as well. The no fear of failure is amazing. I know failure can also be seen as punitive. So to be able to realize that failing means at least you're trying, and that you're building on things. And even if you fail at something, you can maybe, build off of that to succeed in the future. Making consumerism really work, really empowering your patient. That's part of my job. I have to educate the patient on both the disease process, how they can manage it, how to best deal with this in their home environment so they're not coming in and using the hospital system at all the times. Decentralizing approaches to problem solving, which I think is great. Moving the healthcare out to the periphery, out to, the outpatient clinics, the outpatient infusion centers, not having to be in the hospital for all of that. We have many patients who do use the Ann Barshinger Cancer Institute for their chemo treatments. We do have them who also come into our floor, but also those who just need IV antibiotics. A PICC line can be inserted, and then they can just, go home for IV antibiotics, which I think is huge. Not needing to be in the hospital, exposed to everything else that is in a hospital setting. And also integrating new approaches into established organizations. Basically reaching out to the communities that, the organizations in the community that are already well established. That's a major point. And then lastly, the examples for innovation. I'm just going to reference Brian Roberts from the TED Talks. I really liked his whole speech, and his 2 major projections that I loved was that cancer will become a chronic disease to be managed. We've seen that a little bit more, not to the point of where, in 2012 it has progressed since then. And also bringing the hospital into the home with the remote monitoring, like I just mentioned, using the periphery, outpatient clinics. So hopefully by 2022, those will become more of a reality than they are now. And that's about it. Thanks so much.